Meeting to order. We will start with the consent agenda. All the following items which concern reports and items of routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the regular trustee meeting February 23rd, 2021. Minutes of the regular finance meeting March 16th, 2021. And a check report February 9th, 2021 through March 8th, 2021.
I make a motion that we approve the consent agenda, items A through C.
Second.
A motion by Dr. Brown, a second by Dr. Simon to approve the consent agenda as it is presented. Roll call vote, please.
Jasper?
Yes.
Simon?
Yes.
Brown?
Yes.
Bob?
Yes.
Yes, that's it. All right. Next is the CEO's report. Candace.
All right. So for the month of February, we had a total of 34 patients admitted to the floor. We had 183 ER patients seen in February. No grievances or patient complaints filed during that time. We have resumed doing surgical procedures once again, and they're working hard to get caught up and get everybody on the schedule that needed elective procedures done. We have a new RN, Christy Hand, that started working for us. She has 26 years of emergency room experience, so we're glad to have her with us. Upfront collections for February totaled just over $24,000. Physicians clinics, we are working hard to get the Winoka Clinic opened by April 5th. The hours of operation will be Monday, Wednesdays, and Fridays from 8 to 5 p.m. And that will be with Paige Kruckenberg there on Mondays and Dr. Galbraith there on Wednesdays and Fridays. And then at that time, April 5th, Dr. Galbraith will move up to the West End Clinic. We're doing that after talking to BKD as a recommendation because we will soon be getting our designation as a rural health clinic for the West End Clinic. And BKD advised us, because of cost report reasons, that it would be better to have Dr. Galbraith on site in the rural health clinic. So we'll be switching him up here April 5th, and Gwen Holderby will be going from the West End Clinic down to the downtown clinic at that time as well. And we will get that on Facebook and should be maybe in the paper if I remember right. I hope so. If not, it'll be here the next week. Maintenance, Gerald Benson has retired and Brad Wallace has been named as the maintenance supervisor. Brad's doing a great job. Brad's been with us for a long time and knows the ins and outs of all the facilities that we have, so he's doing a great job. Lastly, couple things. We have a revenue cycle consultant coming in from TrueBridge Wednesday and Thursday this week to assist in identifying any opportunities that we have to make improvements in our revenue cycle. We have finally gotten all the reports out of Meditech and eClinicals to help. I told Chris today we have a TrueBridge phone conference every week. There's quite a few people on that call from here and TrueBridge. This was the best week we've had yet since June, and honestly I feel like we finally have our arms wrapped around that project and things are moving in the right direction. We're seeing movement with the cash flow coming in, as well as the reports. You can see the numbers starting to come down, which obviously means cash flow will go up. So we're feeling pretty good about it at this point, that we're all on the same page, and I don't know, finally, it took a lot longer than we thought it would. So patients are starting to see, you're probably hearing that patients are getting a lot of statements from us finally. That process has taken way too long to get to where it is today, but I feel like we're going to have a good process in place, and that patients will be able to have some confidence in what they're seeing. I've seen the statements. They are a lot cleaner than what we were sending, and the process is finally going to work, I believe. So I do apologize for that taking so very long. The last thing I have, if you'll turn after my report, we repeated the employee satisfaction report, and you have a comparison from the last one that we did to the one that we did currently. And I'm pleased with the response that we got. We had about 10 more employees take the survey than we did last time. Like all of the scores had improved, which is good. So I think the things that we are doing are paying off. We're headed in the right direction. We're working on communication is the biggest thing. And if you worked in a bigger organization, you know that communication is always the thing that is the most important and the thing that most people struggle with the most. So we meet with the managers on Mondays in a big huddle meeting at noon, and then Regina and I have small huddle meetings. She has a group that she meets with all of the clinical staff managers, and I meet with everyone else. And so we try to have our one-on-ones and communicate at least twice a week in that manner. So I think that that's helping. It shows that we still have some improvement to do down to the employees. And so we're putting our heads together to try to figure out how we can improve the communication from the managers so that the employees feel like they're getting that communication, which I had hoped would be better, but we've still got some work to do. Overall, comments were positive. Lots of comments with teamwork. Feels like a family environment. They feel, supported and feel like they're a part of a family, which is good. And to take that even further, today we had a rep from AreaVac come, and he said, "We love to fly into Share. It's our favorite place. There's just something different about it. When we come in here, we feel like family." And then one of the nursing instructors said, "I like what I see. I like the teamwork. Can I work here PRN?" So I think those are very positive comments that, and there was some things that we can improve on, and we're going to look at those and try to, make those changes as well. But overall, very pleased with how it went. Anybody have any questions for me?
Any questions for Candace? If not, Candace, thank you, and I would entertain a motion on her report.
I'll make a motion to approve the CEO's board report. Second.
I have a motion by Kim Ball, a second by Dr. Simon, to approve the Share Medical Center written report for March 23rd, 2021. Roll call vote, please.
Simon?
Yes.
Brown?
Yes.
Bob?
Yes.
Jasper?
Yes. All right, Candace, thank you. Next is the CFO's reports.
Okay, so the first thing you'll notice is that we finally are caught up. So we actually have February's statements and January's statements in here. I'm probably not going to go back and talk much about January's. If you want to go back and look at it, have any questions about it, I'd be happy to take any questions. The gist of January was, I think, from what I've heard, like a lot of Januaries, you're going to be down on collections a little bit just because it's the first of the year. But as far as patient days, they were up. So then whenever you get into February, you can see that accounts receivable number at 5.8 million. Kind of like what Candace was talking about with TrueBridge. I'll piggyback on that a little bit. It's high. I mean, that's a high number. There's no way around it. You do see that $300,000 decrease from January. I like to think that's because February was the month that we really started attacking this and really trying to get it worked out. So hopefully that's a sign of things to come, that we can start getting this down and getting a lot of that collected. She said it earlier that we felt good about our meeting today, and we'll see how the consultant goes in the next couple of days. But we're hoping that this is something that we can kind of get back on track, and that number will kind of get lower and lower and get back to where it's supposed to be. As far as revenue for February went, it was over $400,000 decrease from January. You can see obviously the patient days in February were down by over 100 compared to January, and as far as the office visits, the outpatient was about 350 from January. So just a lot less traffic in February than there was in January. But with that, operating expenses in February, we're starting to go back down. We're starting to come out of COVID a little bit, so we're not having to buy as much PPE or extra items that we need for COVID. So you can see the operating expenses going down, as well as the salaries and wages went down, and that should go down again in March because, as you know, at the last meeting we talked about with COVID, with the decline in the COVID cases, we no longer have the COVID pay bonus that all the staff will have. If something changes, then we'll go back and look at it, but as for now, that COVID pay is now gone. So with that, then we have net operating loss of the $75,000. With some of the revenue from the stimulus money, with the expenses that we did have for COVID, that kind of helped bump us back up into a total overall net profit in February of $4,000. If you want to skip back to, do you have any questions about the hospital? Okay, we can talk about the nursing home. Nursing home in January and February, with the COVID cases that they had, because that's where your skilled nursing comes into play, they had a lot of skilled nursing. So the revenue in January and February was quite a bit more than what it typically would be. You can see their accounts receivable, it decreased in February, but there was also a pretty good increase in January. And a lot of that is because of the skilled nursing. And a lot of that happened in January or February. Happened in January, then the payments didn't come through until February. And then also for February, they got some skilled nursing revenue that came in February that we're showing will get paid this week for here in March. So you can see the total patient revenue for the nursing home was $340,000. A decrease of $104,000 just tells you how much they were doing in January, which you can go to January statements and see that was over almost $450,000, which is pretty high for the nursing home. So as long as they have that going, then their revenue will be up there quite a bit. Even with the the total patient days, a little bit of the drop in the patient days, which caused the decrease in the revenue. Same with the nursing home as it was with the hospital. Their salaries and wages decreased, and part of that is because of the COVID pay and the COVID bonus, which for them, they'll handle a little bit differently, which Kelly will probably talk about. At the end of February, they were done with their COVID pay. But if they do have any COVID patients come in, whoever, you're not doing that anymore. Just go ahead and say you're
Not
done with pay also.
Not unless it's a bigger conversation.
Okay. So that gave them net operating profit of $35,000 and total profit of also $35,000. Any questions on nursing home? The homestead, I don't have a lot to say about the homestead. Theirs is, if you kind of look at their 6 months, pretty much right on track with where they typically are. Not a lot of changes over at the homestead, so they're pretty steady with the revenue, and their expenses usually stay right around that $45,000 to $50,000 range, which ends up giving them a net income of $20,000. So not a whole lot to really have to talk about the homestead. They're pretty cut and dry over there. Any homestead questions?
We have several new move-ins over there this month
What's that?
at the homestead.
I didn't hear the question.
You have a lot more, several move-ins.
There's several new move-ins this month.
In March,
Yeah.
I haven't seen March numbers yet.
Okay, very good. All right. There were
I
several-
have seen some U-Haul trucks over there though, but, so I don't know if it's coming or going.
Okay. All right.
Maybe I can
According to
figure that.
Jason's business, they may be kind
They
of.
may be
Yeah.
coming.
That's perhaps.
That's what I read into that.
Yeah.
I'll find out by the time the
No,
report
it's
comes
all right.
along.
Okay.
You know, as far as the statements go, you know, I don't want to beat on it too much. You know, with the AR, it's a work in progress. I think being caught up on the financials gives us more time now to devote more time towards that. The audit also, you know, they sent a list last week of things to try and get this audit finished up. We've sent everything back to them, and we're still just kind of waiting for them to kind of pick up their feet and get this finished. Anytime they're asking questions, we're giving them the answers right back in a matter of a couple days. So we're hoping the audit will kind of clear up. I would hope in the next month. We're kind of on their time on that for the most part. So, but it's all looking promising. You know, we actually have more time that we can devote towards some of these other issues. Whereas with playing catch up, when you're playing catch up the whole time, a lot of other things get put on the back burner. I'm hoping now we can kind of get back into that and try to get this back on track. And then for my perspective too, you know, this is a time that we can start working on that and just trying to learn more in how this more of the medical field works and things that I can be looking for to try to make this even better. So kind of just where we're at now. Anybody have any questions?
Any questions? Okay. If not, we have an item, discussion and action to authorize Candace Allen to appoint the appropriate staff at Bank Central for E-Corp usage and to sign contracts.
Yeah, this is, I'll let Kim, if you want to kind of explain, this is more has to do with our e-court, our login for the financials at Bank Central for the hospital. This just lets us have a little bit more access. Right now, I think we have pretty much minimum access. We can kind of look at it, but we can't do transfers. And I don't even have, or Rosemary have a login. Right
E-Corp
now,
is a product that is more secure for doing your financial activity, and the hospital already has the product, but we need to update the users and their ability to send, for example, the payroll wire would be one example. It would be sent securely, and that information would come to the bank through this secure product.
Whereas right now, we kind
Right
of check
now.
from one account to the other account, deposit it. So those are
Right.
just-
Or there's alternative methods that are not as secure and could leave us vulnerable to fraud, hackers, things like that, and the methods in which we communicate. So we've already got the product. We just need to update the users of the product and allow Candace to update the users of the product at Bank Central so that we can get them the appropriate tokens and security methods on their computers to be able to conduct business on behalf of the hospital.
Okay.
And we'll send training also.
So,
Are we voting over it?
what's this discussion and action? Rick, can we go ahead and vote to do that? Without,
Yeah, action on it.
I
Okay,
do have a question about
okay.
signed contracts. Is that to, what contracts would they be signing?
Authorized users, who the hospital
Just signing the
designates.
agreements that you require?
Yes, and we already have those agreements, they needed updated people listed in the agreement.
I'm not sure she doesn't already have that authority, but the board can certainly vote to approve that. Make sure that she does.
Okay. So, are there any other questions about the Bank Central, the E-Corp with Bank Central?
I make a motion that we authorize Candace Allen to appoint the appropriate staff at Bank Central for E-Corp usage and to sign contracts.
Second.
We have a motion by Dr. Brown, a second by Dr. Simon, to authorize Candace Allen to appoint the appropriate staff at Bank Central for E-Corp usage and to sign contracts. Roll call vote, please.
Brown,
Yes.
Bob,
I have to abstain.
Gaspard,
Yes.
Simon.
Yes.
Okay, motion still carries. Okay. Steve?
Mr. Chairman, every month at this time, since the pandemic began, I've given the board a couple of printouts to show the stimulus funding that we've received at the hospital and at the nursing home, and how we're using those funds, how we're reimbursing ourselves for COVID-related expenses and capital expenditures. For February, the thicker handout is the hospital. I'd have you turn to the second page, and I've shown the usage, the amount of COVID-related expenses we've had at the hospital that we've reimbursed ourselves from stimulus funds. And you can see for February, they were averaging about $22,000 a month. Back in January, it was more like $35,000 a month. And I can tell you for March, that weekly usage of, I said per month, per week, that weekly usage of money for COVID-related expenses has dropped down this month to about $12,000 a week. So we're coming way down. Obviously, it appears that coronavirus is somewhat under control. I hope we don't regret saying that. But, so far, we definitely tell that we're not spending near as much money to deal with the pandemic. So that's just a listing of all the weekly expenses we've had, payroll expenses we've had. We're no longer paying what we call COVID payroll. We're still paying for some capital expenditures. On the very last page of that handout, there's two items we have yet to pay for. The camera and door lock project, I think, is just about complete. Probably just tweaking it and dealing with issues. So we're going to be paying for that. And then we need to pay the balance on our portable x-ray we purchased. So we still got quite a bit of money to recapture from stimulus funding. Right now, we have not received any more stimulus funding for the hospital the last few months. Don't know real sure where that's headed. A lot of it will depend on the coronavirus. I've also included listings of each week what we're reimbursing ourselves for, just to give you an idea of the kind of stuff that we're buying to deal with the pandemic. On the nursing home side, they received about $65,000 in stimulus funding in February. That's the fourth and final installment of some targeted funds from Health and Human Services. So Right now, we don't foresee getting any more of that, but there is a window if we need it in the new act that was recently passed by Congress and signed off by the President. There is funding in there if it's needed, so we may be getting some more funds depending on how this thing plays out. You can see operating expenses have stayed about the same over the weeks and months. At the nursing home, they're definitely starting to trend downward. Last page of that handout, there's a couple of items that the nursing home has yet to pay on the control projects that they've had going over there. So that's kind of where we stand. I thought it was interesting. Another report I didn't bring it with me, but through February 28th, we have purchased and administered 8,930 COVID tests. So you can imagine they have been rather busy upstairs. But, just an indication of the volume of testing that's been done by just this one facility. You multiply that times thousands and you get a feel for the COVID testing that's gone on the last few months. That's all I've got, unless someone has a question about any of that.
Any questions for Steve? No? Steve, thank you. All right, next, medical staff executive committee.
Medical staff met on March 9th, and we have 3 candidates for credentialing, reappointment to courtesy staff, Caroline Hombo, MD. Would anybody like to make a motion since I can't?
I move that we reappoint courtesy staff Carolyn Humble, MD.
Second.
Have a motion by Dr. Brown, a second by Kim Ball to reappoint to courtesy staff Caroline Hombo, MD. Roll call vote, please.
Ball,
Yes.
Gaspard,
Yes.
Simon.
Yes.
Brown.
Yes.
And the reappointment to allied health staff, Brian Nutter.
Make a motion that we reappoint to allied staff Brian Nutter.
Second.
Have a motion by Dr. Brown, a second by Kim Ball to reappoint to allied staff Brian Nutter, APRN, CNP. Roll call vote, please.
Gaspard,
Yes.
Simon.
Yes.
Brown.
Yes.
Ball.
Yes.
And lastly, reappointment to courtesy staff for Dr. Brian Whitson, MD.
Make a motion to reappoint to courtesy staff Brian Woodson, MD.
Second.
We have a motion by Dr. Brown, a second by Kim Ball to reappoint to courtesy staff Brian Whitson, MD. Roll call vote, please.
Simon.
Yes.
Brown.
Yes.
Ball.
Yes.
Gaspard.
Yes. All right. The next item is for discussion and action.
Mr. Chairman,
Yes, sorry.
if I may, I believe we've had a failure to communicate between myself and our staff. The required, under the statute 307B1 is the statute we need to go under, and you're required under the Open Meeting Act to list that section, and I thought we had that in there originally, but it is not in there, and that we have to have strict compliance with the Open Meeting Act, or it subjects this board to possible penalties. So what that effectively means is you can't have a discussion. You can't go to an executive session.
Open session, can we?
Can't
We
just,
can. We can't have it in an open session.
you can, well, you can have a discussion under number 8
Can we
Right,
take
you're basically
action?
in
skip.
open session.
You're going to skip 6 and 7, basically.
You just can't go to executive session because, and just Rosemary, for future, that has to be in there. We had talked about it.
I know.
It has to be in there, the specific section that you're going under. So,
Okay.
Okay.
So you can move to then 8 just as a discussion action
Okay.
in open session.
All right, so we have two physicians that we have been recruiting and that we'd like to pose offering them their contracts, and to do that, we will need board approval to do so. Candace, I'll let you discuss who, I guess.
All right. So I've been in discussion with Dr. Chris Burke and Scott Burke. Chris Burke is a pediatrician. Scott Burke is an internal medicine physician. They are currently in Montana and will be returning home sometime this summer. And we have been in discussion about them returning to practice here and would like to be able to make an offer to sign contracts to get that to happen soon. Chris would be working part-time to begin with. She would work 3 10-hour days. Scott would work 4 10-hour days. What questions do you have?
They would work in,
I think I have a plan, but the city needs to approve that plan first.
okay.
So I'm waiting on that blessing to be able to accomplish just having 2 clinics and not 3 is my hope. It can work, and I think it could work well, what we have in mind. So I could have Scott and Chris both downtown with Steve and Gwen in one office, and then have the Weston Clinic here. And we would still have room for the outreach clinics that we've got queued up to be happening. Some new clinic stuff is coming soon that I don't quite have contracts signed on them yet, but some exciting offerings for our community, and by doing something different downtown would accommodate us to be able to accomplish that. So
You said pediatrician.
just don't want to get ahead of myself.
Yeah, pediatrician and what was it?
Pediatrician and internal med doc, so one like Dr. Self to take care of the 18 and older crowd.
Another internal med doc is something that we've been needing, and you don't always have an opportunity to get an internal medicine doctor. And then likewise, we don't have a pediatrician here. And so that allows us that opportunity to have a pediatrician. And they have local ties and have been here before and served this community when they very, very first started. And they would like to come back. So that's the other thing that you don't always have happen, is everybody wanting to come back. So you kind of couple those things in together, and that's a good combination.
So any more internal medicine docs typically end up as hospitalists in bigger facilities. So the chance to have an internal medicine doc for our town, for a while longer is an exciting thing. So definitely are excited about the opportunity to get both a pediatrician and the fact that she's willing to start off part-time and build her practice and not, us not have to carry a full-time practice until she gets ramped up. That's helping us out as well. She didn't have to do that, but she did offer to do that. So, do you guys have any questions, concerns?
So we would need to make a motion individually on each one.
No, I think you can make a motion simply to authorize Candace to continue negotiations with the 2 doctors discussed. And because that has to come back for board approval, the contract will. You can't approve a contract that hasn't seen it, so, and that would have particulars of what the conditions are and the prices and what you're paying them, but all the benefits and all those things.
Okay, so probably what we'll end up doing,
We'll have a special board.
we'll have a special board meeting.
Thursday. Friday?
I would tell you it'd be minimum Friday, just to have it posted.
At least 48 hours for the special.
So then we need to say, yes, she can continue talking to him, is that what you're saying here?
I mean,
There's
that's,
really no action that's needed.
We
I
can't.
mean, I think she can do that anyway, but.
Okay.
Okay.
Okay, so what,
You just don't have a contract that can be approved.
okay, there's no action needed then at this moment, but we will have a special board meeting
Friday.
if Friday will work.
Friday at noon.
Would Friday at noon work?
You hear me?
I will do all of it.
Anybody?
8 in the morning,
I need at least 4.
7:30, 7?
Noon's good.
Noon's good. It's quick, it's a quick thing, right?
Yeah.
Should be.
Okay.
You want to talk?
My lunch break's this long. But I'll do it.
Would
Okay.
Jay or Bo be back by then too? If it was something else?
I don't know. Bo's house tonight.
No, Bo would still
Bo.
make a quorum for that meeting, if you need him.
Okay.
Okay.
He can still do it.
All right, next item is Quappy.
Coffee. I have that in front of me. Hang on. A couple things with coffee. We deployed iPads to the clinics and inpatients ER to get patient satisfaction surveys done. Seems to be going well. And we are continuing, and I think that might be what's attached, if all of you got that, behind your patient care tab. Behind the validation calendar, it's called a revisions report. All of those procedures have been uploaded onto SPSS, which our employees have access to at all times, so that they can access. We're beginning to finally get our policies and procedures loaded, so that employees can have access to them at all times, which is good. Because sometimes if you can't find the book you're looking for, it's pretty frustrating. So, huge project, a huge undertaking, but we are making good progress with that. That's all I have on that.
Okay. Anything else for improvement?
No, there was just very few on this validation calendar.
Okay, so under these revision reports,
Yes. These are all policies that you've approved through AHA. They're just being loaded
that's
onto
all that.
a platform that employees can access
Alright,
digitally.
okay.
Yeah, they're just going digital.
Okay, so then under D, there was the approval or disapproval of the infection control risk assessment.
That's something that we do annually to determine if there is any increased risk in the facility for any more exposure than normal. And so Amber produces this survey to see if our risk areas have changed.
Okay. So there was no threats or anything of that nature, or concerns or whatever?
No.
Okay. So we need to approve or disapprove the infection control risk assessment. Any questions about that?
Back up just a second. I know we have to take some action on C.
Yeah, we do.
Okay.
Yeah.
I move
On top of this tonight. Gee,
I move we approve the revision report dated February 15th, 2021.
Second.
So we have a motion by Dr. Brown, a second by Dr. Simon for the approval of the revisions report dated February 15, 2021. Roll call vote, please.
Brown,
Yes.
Ball,
Yes.
Gasper,
Yes.
Simon.
Yes.
Okay, the next item is the infection control risk assessment.
Move we approve the infection control risk assessment.
Second.
We have a motion by Dr. Brown, a second by Dr. Simon for the approval of the infection control risk assessment. All right, Kelly.
Roll call vote, please.
Jiminy Christmas. Yes.
Maybe we should just
It's okay with
start
me.
on Friday.
Roll call vote, please.
Ball,
Yes.
Gasper,
Yes.
Simon.
Yes.
Brown.
Yes.
Your brain is waterlogged from all the rain.
Kelly.
Well, if you sit in that chair long enough, it's bound to happen.
Maybe that's a sign.
At least you're not on camera or anything.
Yeah.
Nobody's watching.
For the nursing home report, Chris touched on it, but we have had a tremendous increase in skilled nursing days. That has, that's a higher level of care that we provide when that happens, but it's also a higher level of reimbursement, and it's really good for the finances when we have an increase in skilled nursing days. So that's been good. We typically have a revenue in the neighborhood of 275 to 300,000, somewhere in there, and then with January and February, I think it was 440 and around 350 in February. It's kind of put us right side up on our year-to-date stuff, and so that's good. We did have 5 admissions in February, but we had 7 deaths between January and February. So it's been a little bit tough sledding. We've had some pretty high emotions with, staff through some of this, because it's a lot of people lose all in a short period of time. Today we had another admission, and things are going pretty well. We haven't had any new COVID since February 11th, and that was one we admitted from another facility, so we don't get to count that as our COVID. We have to take care of it, but it's not our number. Our resident family satisfaction numbers, you can see those in there. I've been real pleased with our dining services the last couple months, and our activities, and we'll be working on some of those other areas. Our call system, we're averaging just under 4 minutes for our nurse call, so press the button, we're there in, on an average under 4 minutes. So we've got a lot of calls that are under a minute altogether, so it's going well with that. The saga of our engineer for the HVAC coming out to visit us, at first he was exposed, and then he was one of those that his exposure period went all the way to the end, and then he got COVID. And so we're still waiting on him to get over COVID so he can come out and look at our facility. In the meantime, we have learned some more about the process that the state requires us to go through, and so we'll have the engineer come out and make his initial whatever, but then shortly after that, we'll want to get in touch with the state to have a consultation with their facilities planning review board. That will be, we're all looking forward to that, because it's never comfortable. It's either too hot or too cold, and right now we, have to shut off our air conditioning system during the winter because it's a water-based system, and now some days are 80 degrees and some days are 30 degrees, and so we're opening windows and, running fans and that kind of thing, trying to keep the climate. So we're really looking forward to the engineer coming out and helping us get a new system. We did have have a water line freeze during that cold snap. It flooded a good portion of our west wing short haul, and that was part of our HVAC system too, part of our heater system, that one of the furnaces froze up and burst. We also had a sewer line freeze and all that. And I'm going to call it a design flaw. They ran the sewer line, the original. This was original work. Ran it through an outside air duct.
So rush all that cold air
Yeah.
right over.
So the sewer line froze, and so we had some issues with that. It was a drain line from the kitchen. It wasn't worse than that. But still, it created some problems. We couldn't run our dishwasher for a few days, and but other than that, we survived the winter apocalypse. Our door lock system and our roam alert system have been installed. They're completely installed, but we are still having some punch list items come up that need to be corrected. One of the technicians was back out today, fixed a few things. They'll send somebody back out tomorrow. There's another mag lock that's going to have to be replaced. It's not, we don't have we didn't upgrade all of the mag locks thinking that we would still be able to use the ones we had, and so we've tried that. Some of them are still good, some of them are needing to be replaced, so we've got some of that going on. Our code alert system with the roam alert system is working with our pagers. So what that means is every time we admit a resident, we do a elopement risk assessment. So are they a risk of leaving the building, and then there being a silver alert in the community or something like that. And so for those people that are at risk, one of the interventions is this roam alert system. We now have it set up to where there's not an audible intercom announcement that says, it's so annoying.
West door.
Code alert, west door. And it's been messed up for the last little bit until they fixed it. And so it would go through in every door. So we really didn't know where people were. But now, as they get some of these mag locks, traded out and the new system in place, it sends a page to our nurse call system so that we know what resident is at what door, and that's where we need to go check to make sure that they're not leaving. So, and that it causes the doors to lock, and of course it's got a, don't tell them, but there's a 15-second delay. If you press on the door, it will open. So, I hope they're not watching. But it's a much better system for us. It will allow us to be more responsive to that need among our resident population. We are really getting heavy into our phase 2 implementation of our electronic health record. This week we've been trained on how to upload all of our documents that need to be signed upon admission, or even if it's a consent form for a vaccination or whatever it may be. We'll put all those into our system. It'll have I don't know if any of you are familiar with DocuSign, but it's a similar process to that, to where we can have a secure signature electronically, even if you are in Pennsylvania and you need to sign our admission document for your mother. It sends a secure authorization code to a text message or email, and so when we're on the phone with you, we send that, and it verifies that it's you when you tell us that's the code. And so we're anxious to get all of that going. We have a lot of paper still over there, and we're hoping to not have as much paper moving forward and have a more complete medical record than what we have had. You can see our vaccination numbers there. For employees and for residents. I'm pretty pleased with our vaccination numbers. We're over half, closer to 75%, I think, of the staff that work for us regularly. And the residents, once they, we had some of those that had the BAM infusion, so they've got a 90-day wait for their doctor's preferences to get their vaccinations, and we're set for them to get theirs whenever they can. I guess the biggest thing is March 9th, the governor released, along with the State Department of Health, guidelines for nursing homes. And then March 10th, Medicare released guidelines for nursing homes. And then also on March 10th, CDC issued guidelines for nursing homes. And so on March 17th, the state came back and said, okay, because they all contradicted each other. The state came back and said, okay, this is how you need to interpret all these guidelines, and this is what you need to go by. So as of March 17th, we are not requiring, we are strongly encouraging vaccinations and testing for those that come to visit our facility, but it cannot be a condition for people to be able to visit their family members. We still do limit the number of people in the building at a time. We still do limit the number of people with any resident at a time. And we will also have scheduling required. So no popping in, unannounced, that kind of thing. It's going well so far. Our visitors are able to get in and see people when they need to see them. The schedule's not been too crowded. We have made a switch to now we keep one person at the front door from 8 to 5 every day to help with that. And it's actually 3 people that split it, but I think it's going well. Haven't had any, we still have to screen everybody in and screen everybody out. So if you come to visit, you're going to get your temperature checked, and we're going to ask you a bunch of screening questions, and when you leave, we're going to take your temperature, and we're going to ask you all the same questions again. But I think it's going well. It's been good for our residents, and it's been good for our staff to see people again from the community, and I'm glad that we're able to do that. A little concerned what's going to happen, because it's going to stay the same rule even if our county were to experience an increase in positivity rate. We're not going to be able to require testing or vaccinations even if the county's COVID experience worsens. So that's a little concerning, but right now things are going great. The other thing is that last 2 weeks we've had our annual Leading Age Conference. It's the nonprofit professional organization for nonprofit long-term care providers. And so we ended up having 9 employees be able to participate in that virtually, and probably well over 150 hours of education for our staff. So that was good. And that, I think, will conclude my nursing home report, and I'm happy to answer any questions.
Any questions for Kelly? If not, how about the homestead? Homestead
has not had any move-ins, but we're expecting one next week, and we've had lots of lookers. We have had a couple move-outs this month. So one was a contract nurse, and one was resident needing a different level of care. So, but it sounds like March, the end of March and into April, we're going to see an increase in homestead census. So their census in February was down a little bit from January. They have been cautiously, opening back up as well. Of course, they're not under as strict of guidance from the state or federal government for their reopening plans, but they're still a tight pack, kind of facility when people all get together, and they're trying to help make sure that their residents stay safe through this reopening transition. They've been refurbishing apartments as they've been able. A one-bedroom and a studio were refurbished are being refurbished right now. They might be finished by now. We've had some issues with some equipment at the cafe. We had a new ice dispenser ordered. It's the city's expense for that piece of equipment, but we had some issues with that fitting into our space, and so I think we're still trying to get that worked out. And they survived the freeze without any problems this year. A lot of people huddled around the fireplace in the lobby for quite a bit of time, and seemed like there was good socialization going on with that. And then they're doing some annually. They've been doing an ad in the Enid News and Eagle Medical Directory, and that came out, and I saw one at my mom's house last week, so I know that's out in front of people. We usually always get 1 or 2 referrals based on people seeing that ad, and Morton pays for the ad, so we continue to do that. Like Chris said, the finances are pretty well what they are. They average what they average in revenue and expenses, and they always come out in the black, so no, they ain't broke, don't fix it, I guess.
Any questions for Kelly for the homestead? If not, Kelly, thank you. No St. Anthony's report. Bo is not here, so we don't have a city council's report, but I will mention that tonight was to have been his last meeting. He goes off, he turns out at the city council, so we want to first thank him for his time and effort and years of service and dedication to not just here to SMC, but also to the city of Alva. And we'll await an appointee from the mayor to fill his position.
To be clear, that appointment will come from the city council.
Okay, very good. Sorry. I haven't got anything else right tonight, so I mean, it might as well be. So we have no items of new business other than we will have, and we need to make sure that's posted before noon tomorrow, for a special meeting at noon on Friday here. We are adjourned. Thank the Lord.